Well, you've probably noticed a massive wave of products targeting your stomach, or you've heard more people talking about gut health and the gut microbiome. I sat down with gastroenterologist Dr. Khanna to talk about why it's so important and to learn what simple steps can help keep your gut healthy. Especially lately, we have heard the term gut biome. Can you explain to people who aren't familiar with it what it means and why it's important?
There is a whole slew of microorganisms that live in different parts of our bodies. Skin, mouth, nose, eyes, ears. But the organ system that harbors the most number of microbes in our bodies is the gut, or the intestines, primarily the large intestine. When you look at sheer numbers, it's estimated that we have 100 trillion microbes that live in one human being. That's 10 times the number of human cells that we have. These bacteria are not just living off us, they are metabolically active. When I mean metabolically active, they produce substances that are required and needed for the body to function appropriately. They also create what we call as a resistance against pathogens, meaning if you get exposed to a pathogen, if you've got enough good bacteria in your intestines, a lot of times you won't get infection from that pathogen.
So it's not just digestion?
Not just digestion. I'll give you a few examples. We've seen that there is an alteration in gut bacteria with many, many diseases. Starting from top down, neuropsychiatric illnesses, Parkinson's disease, anxiety, depression, autism, a lot of these neurological illnesses have altered gut bacteria.
So how does an individual take care of their gut? What should we be doing?
Very simply, if there is no contraindication, drink a lot of water, at least 8 cups a day. Be on an exercise regimen, sleep well. These 3 things have shown to improve gut bacteria. Have variety in your diet. The more number of colors and different kinds of foods you'll have on your plate, that's going to try to feed the useful bacteria in your intestines.
Would a probiotic help renew the gut microbiome? Because we hear a lot of talk about probiotics. So what exactly is that?
Most of the times, probiotics are not the answer to replenish your gut microbiome, especially even after antibiotics. What's the answer? Feed the good bacteria that have been suppressed. Give them the fiber that they need, give them the water, give them the exercise, and your gut microbiome will improve, enhance, or recover in most situations.
What about yogurt?
Lactose intolerance or intolerance to those food products you can consume. So yogurt's going to have more cultured bacteria, more live, and it may help interact with the other live bacteria in your intestines to propagate. It's not going to harm you. Is the benefit exponential? That's unknown completely. But yes, it's cultured foods, yogurt, sauerkraut, kefir, those things are not going to harm you.
Let's say a viewer is watching right now. If they wanted to start improving their gut health today, what are 2 or 3 simple evidence-based changes that they can make? Is it?
If I were to give one simple thing to everybody in the United States, when you pick up something from the grocery store, please look at the food label. Please look at the food label. See how many calories, how many grams of sugar, what are you going to get in each serving, how big are those servings, and then what are the ingredients that are out there. We all should think about doing that, and then you will realize what is being sold as tomato ketchup may not have tomatoes as the main ingredient. Look at food labels.
Dr. Khanna emphasizes that if you are experiencing persistent digestive issues, you should skip the over-the-counter testing kits and see a physician immediately. And he just wrote a book. It is called Mayo Clinic Guide to Gut Health, and it's available now wherever you get your books.
So you were surprised this connection and how important it is to potential diseases and health problems.
Yeah. Do you guys pay attention to your... I'm a lot older than you, so.
I do. I mean, I think that there's so much garbage out there on the internet when it comes to what you should do and shouldn't do in these test kits that I really appreciate this story and what the doctor is saying because it sounds so very important.
Well, and he simplified it a bit because you showed the sodas, you showed all the things that are saying you're getting your prebiotics, your probiotics, and he made it actually a lot more simple. He's like, just sleep, drink enough water, eat enough fiber. Like, don't think you're going to find a magic thing.
Yeah, that all these doctors say, right? Sleep well, eat whole food. Yeah. A lot of water, exercise. I mean, I think it's the same kind of advice that we get over and over, like, to be healthy.
I'm curious more about the fermented foods because I'm a kimchi
addict.
I think it's good.
Self-proclaimed. It
doesn't hurt. No, he said it won't hurt. It was very interesting, though, I thought.
It was. Good report. Thank you.